look up for a sign. It's becoming increasingly clear living in cramped quarters in lower income areas puts people at a higher risk for COVID-19. Toronto is the latest city to release socio-demographic data showing the rate of infection in the city's poorest neighborhoods is 3 times higher than its richest, and areas with overcrowded housing have been hit up to 4 times harder.
For a long time in Toronto and in other cities in Canada, there's been an undersupply of affordable housing, and we are now realizing an immediate harm from that.
And it's not just where people live, but where they work, with low-wage earners on the front lines knowing if they stay home, their families will go hungry. That's what they hear at this community health center.
It is part of what we see every day. We're certainly going to see it more during a pandemic.
The data indicates Black and South Asian people here have been hit especially hard, hence calls for greater community testing, like at this church in the Jane and Finch district, where activists have seen chronic poverty and racism worsen health outcomes for years.
There is absolutely, again, no surprise. I don't know how many, different investigations or research needs to happen.
Question is, what can be done? Some want more public health advice in languages other than English, but also a wider shift to a so-called living wage and affordable housing.
We know that when the inequities are smaller, when they're reduced, that actually the entire society benefits.
At a local level, the needs are not new, but a pandemic on a global scale has made the urgency even clearer. Thomas Daigle, CBC News, Toronto.